If you are caring for someone showing symptoms of COVID-19 in your home, these are some important ways to protect yourself and others from becoming infected. It's best to treat whatever an infected person interacts with as a source of contamination. Ideally, they should stay completely separated. They should eat in this room and even use a separate bathroom from others in the house if possible. Designate a set of household items like dishes, cups, and towels that are specifically for this person's use and that others will not use for now. These items should be kept and cleaned separately from non-contaminated items. While caring for the infected person, you should still try to minimize the time of interaction, as the longer you are potentially exposed, the higher the chance of getting infected. Have the infected person properly wear a face covering anytime they are around people, including yourself. As a caregiver, you should also wear a face covering when you need to be in the same room as this person. Wearing face coverings are only effective when used properly. The face covering should sit snugly against the face and cover both the nose and mouth. Since the virus can travel in respiratory droplets from even just talking and breathing, a face covering is important to help contain the person's respiratory droplets as much as possible. Don't touch the external facing part of your face covering when wearing it and taking it off. The external facing part is more likely to be contaminated with virus-containing respiratory droplets because the droplets are drawn towards the mask as you breathe through it. Wash your face covering daily in between uses. As a caregiver, you should wear gloves whenever in contact with the infected person and the items they're using. Wear gloves when cleaning and disinfecting their personal items. Surfaces that the contaminated items may have come into contact with outside the room should also be disinfected. For example, you should wear gloves when handling the infected person's dirty laundry and also disinfect what that laundry has touched, like their laundry hamper. If the person feels up to it, you can give them their own cleaning supplies like paper towels and disinfectants, so they can clean their own space to limit your contact in their space. Even if this is the case, you should still daily disinfect frequently touched surfaces around the house, like tables and countertops, faucets, keyboards, doorknobs, phones, and light switches. You can disinfect with diluted bleach solution, or a product with at least 70% ethanol, or 2% hydrogen peroxide, or commercial disinfecting wipes. But remember, never mix cleaning solutions. Using gloves when cleaning and handling the items used by the infected person will only help to keep you safer if you use them correctly. Be conscious of the fact that your gloves don't disinfect anything. Treat the outside of your gloves like another contaminated surface. Touching other things with these gloves on will also contaminate those items. So when you have gloves on, don't touch your face or anything that you aren't then going to decontaminate. Remove your gloves without touching the outside part and wash your hands right away. If you're living with someone with COVID-19, you and others in your household may be at a higher risk of spreading the virus. All of you should be especially vigilant to protect others. Try to minimize outings and always wear a face covering over your nose and mouth when around others. Monitor your own health for COVID-19 symptoms. Measure your temperature for fever. Watch for dry cough, shortness of breath or difficulty breathing, sore throat, and loss of taste and smell.